Hi class, just wanted to hop on and share with you our condition presentation, which is the neurodevelopment disorders and gastro issues. The classmates that are part of this presentation includes myself, Rafaela, Penny, and Sabrina. Throughout our slideshow, you will receive an introduction before each disorder to kind of just get basic information on what the disorder is. And then also throughout the PowerPoint, you get different types of disorders, just as this slide shows examples, and the different symptoms. And then the same thing with the gastro issues, kind of going over an introduction of that. There'll be a slide with the article summary that we have chosen, and then you will learn a little bit about a few different conditions such as intellectual disability. So this is the overview of intellectual disability. We also have included a few related videos for intellectual disability so you guys can learn more about the disorder. They're very good videos and I highly recommend watching them to learn more. In addition to intellectual disability, throughout our PowerPoint, you'll learn about autism spectrum disorder. So this is the overview of that. Again, we have included a few related videos to autism spectrum disorder, so you could learn a little bit more about that. And then we have included different websites that you could view about the different disabilities that we discuss. And then our last page will include our reference page. So we hope that you learn a lot from our presentation and you enjoy it. Thanks. Bye.
Hello. Today I would like to discuss neurodevelopmental disorders and gastrointestinal issues referred to as GI. There are many neurodevelopmental disorders and many issues that arise from them, so let's just break them down a little bit in a simplistic approach to a large issue. Neurodevelopmental disorders are disabilities that are associated primarily with the function of neurological systems and brains. So to make that more simple and more relatable, people with ADHD, learning disabilities, conduct disorders, intellectual disabilities, autism spectrum disorder, cerebral palsy, disorders like those are all neurodevelopmental disorders. Brain function. Disorders of the brain affect emotions, learning, auditory responses, vision and hearing, and impulsivity and memory. Those with neurodevelopmental disorders can experience issues with speech, motor skills, behavior, memory, learning, or other neurological functions. While symptoms and behaviors of neurodevelopment disabilities often change or evolve as the individual grows older, some are permanent. Neurodevelopmental disorders are usually diagnosed in childhood. They are commonly linked to gastrointestinal issues, which we refer to as GI. Common symptoms are stomach pain, bleeding, bloating, constipation, and diarrhea, heartburn, incontinence, nausea, and vomit. In some cases, feeding tubes are necessary to prevent malnutrition in patients that cannot retain food. GI issues are very common in children with autism. And today, I would like to discuss the article Problem Behaviors Linked with Gastrointestinal Issues in Children with Autism. That's a mouthful. Psychiatry and researchers from University of Missouri conducted a study for more than 340 children and adolescents with autism and found that 65% of the individuals suffered from GI issues and symptoms. That's a pretty large percent. Dr. Ferguson's article pointed out that autism can affect your cognitive, verbal, nonverbal skills, which has a play on whether or not a person can tell you if they're hurting or whether they don't feel good or they have a fever or whether certain foods bother them when they're not being digested correctly in the GI system. So, what he did is he started doing different stress tests so that way he can see whether or not they were hurting whenever they couldn't communicate verbally or non-verbally. Ferguson and his colleagues also found that the relationship between the problem behaviors and the GI symptoms differed between young children and older children with autism. Aggressive behavior in younger children aged from 2 to 5 years old was associated with upper GI tract issues such as nausea and stomach pain. Older children and adolescents aged 6 to 18 often experienced greater anxiety and were more likely to experience lower GI tract issues such as constipation and diarrhea. With that being found, they were able to use that type of research to see exactly how to treat these symptoms that the kids were going through, because a lot of kids that have any type of neurodevelopmental problem have issues whenever they are being taught in school. Sometimes they act out inappropriately, and sometimes they have problems with incontinence or going to the bathroom. And it's important to understand exactly, what that child or individual is going through. And so that was one of the benefits of this study. He started, him and his colleagues started using a drug called propranolol. I'm pretty sure I said that. I probably messed that up pretty bad. But it's a clinical trial drug that's used in blood pressure, and they have started to see some results with that. What they started to focus on the most was treating the nausea and diarrhea and things like that, in hopes to regress, of course, aggression, but also help them to feel better and be able to concentrate more on educational endeavors, or also keep them out of the hospital and happen to have any type of GI tubes or bags to help them. Researchers do hope to have an initial result in 2020. However, there has been a lot of different research treatments that's been used before to treat neurodevelopmental disorders, and it will most likely take several years before they find something that is at least 90% effective, because at this point there's so many different complications with having GI issues. I hope that helped out a little bit and educated you a little bit more. I know in this research, it did help me out a lot. Thank you.
Hi everyone, I wanted to go over the diagnosis of intellectual disability. First, I'm going to use our Allen Francis reading book. I think it's a good way to get things started about intellectual disability, and then we could go over that disorder in the DSM-5. So as we know from reading the chapter, there's a few ways an individual can be diagnosed with intellectual disability. There's mild, moderate, severe, and profound. So those are 4 different types of diagnoses under the intellectual disability umbrella. It really goes over the way you can be diagnosed with intellectual disability is based off of the individual's IQ score. The DSM-5, the cutoff is 70. So if the individual's score is below that 70, that's how they can be diagnosed with intellectual disability. It's that low score of the adaptive functioning. And from reading our books, we learn that. A few differential diagnoses. These are rules that conditions out. Those include borderline intellectual functioning, autism spectrum disorder, specific learning disorder, major neurocognitive disorder, and any other mental health disorders. A few tips for this disorder includes, like we stated, the IQ testing, error of measurement, IQ scores above 70. So even if it's 5 points up, you know, that could definitely make a difference. A few other things stated in our reading is the age of onset, relation to autism, and specific learning disorders. And then that's kind of where the book ends on that, because then it goes into the specific learning disorders. So really love this book. I actually purchased it because it's just an easy read and goes over all of the disorders very well. So I just wanted to kind of start off with it like very basic before going into the DSM-5. So for the DSM-5 intellectual disability, I can review really quickly with you what the definition is in the DSM-5. Intellectual disability is a disorder with onset during the development period that includes both intellectual and adaptive functionings. So those can be your social cues and things like that. So there's 3 criteria that must be met, which is the intellectual functioning, such as reasoning, problem solving, planning, thinking, judging, academic learning, and then learning from experience. And the second part is the adaptive functioning, which is failure to meet developmental and social standards for personal independence and social responsibilities. And then the third criteria is the onset of intellectual disability and the adaptive piece of it. Again, we went over the different ways that an individual can be diagnosed, which includes the mild, moderate, severe, and profound. So I wanted to kind of include this in the presentation. These, I always just love throwing like words on a screen, so I found this one for intellectual disability. I could read a few of them to you. It says intellectual, delays, behaviors, below 70, neurodevelopment, adaptive, general, child, low IQ, levels, and mental retardation, which that is no longer used. Now the diagnosis is intellectual disability. So that is no longer a diagnosis. With working in the mental health field, I do not like when I hear that word. I know some papers have that written. Like within the county, they still have mental retardation on their forms and kind of like makes my blood boil. But I guess back then it was different, so I'm trying to like understand that piece. But again, it is intellectual disability. That is the diagnosis. So throughout our DSM-5, they made a cute chart. Here's like the book, and kind of goes over the different levels, which is, again, the mild, moderate, sorry if I could turn the page, severe, and profound. So that, again, is in DSM-5. If you want to learn more about the levels, that's on page 34, 35, and page 36. All right, so now if we look at a few of the risk factors, genetics is definitely one that can include a copy number involving one or more genes. So that's a chromosome disorder. So that could definitely be a risk factor and be a reason why an individual can be diagnosed with intellectual disability. Brain functioning, it could also be, so that's kind of the genetic piece of it. Another way could be environmental, alcohol, other drugs, anything kind of related like that in an individual's environment. So there could be two different reasons for the risk factors for that disorder. Let's see what we could go over with this. Okay. All right, I think that covers a good amount in the DSM-5. I also included a few slides that goes over intellectual disability. This is my first slide. Again, I just like to throw these words out so we could look at that. I have included an overview of the condition intellectual disability. So this definition was found from the DSM-5 Intellectual Disability Fact Sheet. So it states that intellectual disability involves impairments of general mental abilities that impact adaptive functioning in 3 domains. And those 3 domains are included there. I kind of broke it down for you, and this is everyday task, reading, writing, math, your memory, that's definitely one big component. And the other is the socialization piece. Can the individual communicate? Are they able to make friends and keep friends, or do they have difficulties with that? And then the other area is self-management, such as personal care, jobs, money management, and organizing. Organization is huge. So that's kind of just a brief overview of intellectual disability. I also have included the related videos for this disability. So there's 2. I have one video that I picked that's just kind of like, again, an overview. And then I have another one. It's a TED Talk with a parent that has a child with intellectual disability. So I thought that was nice to include. It is a little difficult to understand, so you really just have to pay attention to the parent on there. So I hope you enjoyed a little bit about intellectual disability, and I hope you learned a lot. And don't forget to look at the videos. Oh, and then one last thing I also included on slide 12. The first one is the Special Olympics. So it kind of is broken down to what is intellectual disability, services for intellectual disabilities, and some type of activities for the individuals to participate. So I included that. So if you wanted to learn more about intellectual disability, that is there. All right, guys, I hope you enjoyed the section for intellectual disability, and I hope you all have a great week. Bye.
Hello, my name is Penny Watkins, and I will be doing an overview of autism spectrum disorder. Autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others. The disorder also includes limited and repetitive patterns of behavior. The term spectrum in autism disorder refers to the wide range of symptoms and severity. The DSM-5 has criteria to be diagnosed with autism spectrum disorder, A through E. A, persistent deficits in social communication and social interactions across multiple contexts, currently or by history. B, restricted repetitive patterns of behavior, interests, or activities, currently or by history. C, symptoms must be present in the early developmental period, but may not become fully manifest until social demands exceed limited capacities, or may be masked by learned strategies in later life. D, symptoms cause clinically significant impairment in school, occupational, or other important areas of current functioning. And E, these disturbances are not better explained by intellectual disability or global developmental delay. The DSM has been around since 1952. Autism wasn't addressed until 1994, and it was revised in 2000. There has been a series of changes that led to a few controversies. These changes required no specific age requirement because their goal is to have early screening, which equals early interventions. They wanted to have better integration of categorical and dimensional assessment of criteria, and to identify characteristics and improve diagnosis without limiting sensitivity or changing the amount of children that will be diagnosed. So, autism spectrum disorder has criteria A and criteria B. Criteria A is social emotional reciprocity, nonverbal social communication, and reciprocal relationships. Criteria B includes repetitive speech, movements or use of objects, adherence to routines or rituals, restricted intense interest, and unusual sensory interest reactions. There are 3 severity levels: level 1 requiring support, level 2 requiring substantial support, and level 3 requiring very substantial support. The social communication among level 1 is without supports in place. Deficits in social communication cause noticeable impairments. Social communication for level 2 is marked deficits in social communication skills, social impairments apparent even with supports in place, limited initiation and response. Social communication for level 3 is severe deficits in verbal and nonverbal social communication skills cause severe impairments in functioning. There are restricted repetitive behaviors amongst level 1, 2, and 3. For level 1, it causes significant interference with functioning in one or more contexts. For level 2, it appears frequently enough to be obvious to the casual observer and interfere with functioning in a variety of contexts. And level 3, marked interfere with functioning in all spheres. Autism has a relationship with social pragmatic communication disorder. A lot of the times people will have trouble differentiating the two. But the biggest difference in the two is restricted and repetitive behaviors. With autism spectrum disorder, you have in social communication along with restricted and repetitive behaviors. To be classified as social pragmatic communication disorder, SPCD, you only have impairments in social communication. Now, being that there is 2 very similar diagnoses, one would have to make sure that they look at those repetitive behaviors to see if one would be diagnosed with ASD or SPCD. When one is diagnosed with ASD, there are some implications for cultural identity. There is a reaction based off of families, and reactions can include acceptance, fear, rejection, defiance, suspicion, or reassurance. On a day-to-day basis, I work with children with autism, and they want people to understand them, to listen to them, be there for them. Want somebody to be genuine. These individuals require a lot of attention and sometimes does not get that attention at home. So it is important to accept them. Don't be fearful. Don't reject them. Don't be defiant against them. It may cause some suspicion, but don't allow the child to see that or person, and to give them reassurance or cost a series of time. These are condition-related videos. One video is on autism spectrum disorder, and the other video is on building a relationship with someone who has ASD.